What if I told you that as a doctor I have information that could save your life to the effect of lowering your risk of dying by 20%? You'd want that pill, wouldn't you? Today I shared with the patient a study that was published in 2014 in the American Journal of Medicine. Researchers took a look at a database of about 4,600 older Americans, and they tried to determine which factors determined if a particular person would die or not. They looked at the height, the weight, the blood pressure, heart rate, whether the person had a history of cancer, cholesterol, kidney function, diabetes status, insulin levels, and glucose levels. They did many measurements trying to determine how can we figure out what is a risk factor for dying in older Americans. And the number one risk factor was not cholesterol, was not smoking. What was more important than any of those was the muscle mass index. Americans that have higher muscle mass are much less likely to die than those that have lower muscle mass index. What they did in the study is they broke down the group of 4,600 patients into 4 equal groups statistically based on their muscle mass. So the first group are quartiles, 4 equal quartiles. The first group had the lowest muscle mass at 0 to 25% of the average. The next group had 26 to 50% of the average. The next group 51 to 75% of the average. And the final group 76 to 100% of the average. Group 4, which had the most muscle mass compared to Group 1, which had the least, had a 20% chance lower of dying. So in older Americans, this is not weightlifting bodybuilders, really buff people. This is average older Americans. In 2014, a study was published that showed if you have more muscle mass compared to if you have less, you have a 20% chance less of dying over the course of 10 years. So I highly recommend for all my patients, get yourself exercise bands. You can do exercise at home, resistance training to gain muscle mass. Go to a gym, get a trainer, lift weights, use the machines, do some kind of resistance training. Americans that have higher muscle mass compared to those that have lower muscle mass are about 20% chance less of dying over the course of 10 years as they're older. And that's probably the most important intervention we can do and the easiest intervention we can do for ourselves. Dr. Ron Hecker with Lap-Band Doctors, as we discuss the latest in exercise, fitness, nutrition, food choices, food habits, and all that as it relates to our health and to our weight. Thank you.